Good morning, everyone. Thank you for coming together again for an update on things that are taking place at the university. We have a number of slides that'll be in the background today because it's fall, or at least it's almost fall. And this is a time of year that there's a great deal going on at the university for events. And I want to make sure that we give some airtime to those because I think they're very important, many of them affecting our employees and many of them affecting our students. We'll start off, as always, by recognizing our great. Since my last opportunity to speak with you, it's been 4 weeks. We've had another $1.1 million in grants come in to the organization. Dr. Rauda, Dr. Samara, Dr. Civic, Dr. Welton, Ms. Ribnick, and of course, Dr. Kazimov. Now, Dr. Kazimov gets a little special call out because about almost half of the $1.1 million was a grant that Dr. Kazimov brought in through the National Institutes on Aging. And of course, NIH grants are always a benchmark that we track here. So congratulations to all of them. We look forward to seeing the fruits of their work. And it's been an amazing year already for research dollars coming in because we have truly talented faculty who are not just great educators, but great researchers. And that means a lot at the university. I do want to recognize a couple of people today. Dr. Corey Stofko, she has stepped up and is a member of the national organization. It's AAMC. I think most of you know the Association of American Medical Colleges. Whenever we have leadership from our team at that level, it shows that the university is participating at a national level in shaping medical education. And I think it's really important that we call this out, that we note the work that Dr. Stofko is doing for us, and it really gets the name of the university out and shows that we're helping to shape medical education. The other one is, of course, all of us know Jordan. And Jordan Sindrich has built our Lean Six Sigma programming at the university, and amazingly is now the chair of higher education networking group for the American Society on Quality. And this is a big national organization. So Jordan, congratulations. Once again, it gets our name out there to show that we are leading in this area, and this is a very prestigious organization. So thank you. I'm really pleased to announce that we learned last week that the Timken Foundation is donating $1.63 million to Northeast Ohio Medical University for our Medic Lab. And the Medical Lab is the medical innovation center that's been created in the old cafeteria space. It's growing, it's supporting both master's degree and certificate programs, our Neovations program, and is really going to be a key piece of a new joint venture that we're doing with Bounce Innovation Hub and partnering with University Hospital Ventures on. So you're going to see a great deal of work taking place in that space, more than you have already, as we thank the Timkens for a $1.6 million gift coming in very quickly, and you'll start to see additional changes. That is a space we want everybody to use. It's about getting together a collision space for innovation and entrepreneurship and supporting a lot of the programming at the university in those areas. I'm also pleased to tell you that I received a phone call last week from Dan Simon. Many of you heard Dan speak at the Vitals presentation. He let us know that the University Hospital's Board of Directors has approved a new affiliation agreement with the. We had one previously, and that one was contributing about $5 million to NEOMED on an annual basis for us to grow programming together to support the hospital system. And the one that passed last week will be over $20 million a year. And I think you're going to feel great impact from that from across every area of the university. We've not outlined where those areas are yet, but we will within the next week. It's going to have a great effect on both students, faculty, research, and education. UH is our newest partner. You know that we've had strong and enduring partnerships in Akron, Canton, and Youngstown through Mercy Bon Secours, Mercy St. Eves, and then, of course, Altman, Akron General Cleveland Clinic, Mercy Cleveland Clinic, Akron Children's Hospital in Summa. Those are some of our biggest partners. And now we add university hospitals to this. So we serve all of Northeast Ohio, as our charter was intending for us to do. So please stay tuned. You're going to see some really great opportunities, and you're going to see some funding that's going to be coming to many of you, especially in the research and in the education space. I have to give you the update on this because this one surprised me when it came through. I didn't know it had come through, and it's going to affect some members of our community. A joint economic development district has been approved and includes NEOMED and it includes Rootstown. It's a partnership with Ravenna and the township of Rootstown, which we are in. You should reach out to your local leaders to figure out what the impact will be. But we were informed that it did pass and that NEOMED is included in it, which means there may be an increase in local taxes for some, but not most individuals, is what we've been told. So I still am trying to get my arms around this completely. The intent is that it's going to support regional development in our local community. And we've been told that NEOMED will have a member who's allowed to be part of the steering committee or the board that is behind this. But I didn't know it had passed until I received an email. And so for many of you, if you don't know, especially if you live in Rootstown itself, or if you live in a township that does not currently impose taxes, you may feel a little bit of a difference behind this. And so I think it's important that you reach out to your local community leaders to see what impact this may have on you. This is not a NEOMED initiative. This is something that will affect us. We also just celebrated the 3rd annual Neovations program, which is a bench to bedside competition, bringing together clinicians and a multitude of students from across our university and others who go out over about a year period of time and figure out how to create new solutions to unaddressed medical problems. It was a great event with about 14 teams last week. We had a number of visitors from outside the university, and we were able to give out financial awards to continue to support those student teams that are creating companies and trying to get new products in the market. This is about experiential education. We do a great job with didactics and teaching. In our experiential education is usually limited to the clinical setting, but this is an opportunity for students to partner with healthcare professionals and try and create new solutions that can be commercialized to the benefit of our patients. A big thank you to Dr. Hope Ball and Dr. Safadi and the student leadership team who helped to get this going. We're going to see a big expansion of this program from 14, and what I'm hoping is a target goal of 50 interdisciplinary teams for next year, which will be able to leverage the Timken gift in our new innovation lab and really promote this from across our entire region, something the governor's office is very interested, which is entrepreneurship and how we can not only improve healthcare, but have economic impact in our local region. I want to thank everybody for their support for the VITALS program. I think all of you know by now, because I've said it so many times, VITAL stands for Value, Innovation, Technology, Advocacy, Leadership, and Service. And these are the tools that we use to try and improve healthcare, improve access, improve affordability, and overall just improve care for our communities and for individuals. We started this program about 3 years ago. We're actually going into our 4th year. Dan Simon was the first speaker in that series, and it's become more and more popular. But your attendance at the last event was incredible, and I really want to thank you for your support. University Hospitals is planning to now underwrite that program for us for this year and into the future so that we can help get it out more nationally and have bigger impact. But this next speaker that we are having is Dr. Kendall Cobb, and she's the Associate Chief of Staff at the Cleveland Clinic, and she's going to speak to us about the work that she's doing in health equity. I hope that you can attend. I believe this is a Zoom event this time. We are trying to do 3 to 4 in-person events a year, and the rest of those are Zoom. It's just an easier venue for people to get to. It's also the week of wellness. And I bring this up because you're going to see a lot of activities happening on campus to support our students, especially our students. Higher education is suffering from a multitude of problems right now, but student wellness, especially around mental health, has become a big issue. So we have a number of events that are taking place today, all throughout the week. Dr. McPherson and her team are doing a wonderful job with this. I will say that I'm going to tell Dr. McPherson that she's thrown me under the bus a bit. There's something she's created called the President's Push-Up Challenge, where on Friday, I'm very much expecting that a bunch of 20 and 30-year-olds are going to crush me and show that a 59-year-old man with rotator cuff injuries can't keep up with them. So thank you, Sandra. But please, if you have the opportunity to come out and cheer on the students and not make too much fun of the old president, that would be wonderful if you're able to do so. I think it's in the new center, as I understand it, out in front of Starbucks. Is that right? Yes. It's also Hispanic Heritage Month, and there is a Latin American travel fair that's taking place on September 26th from noon to 1:30. If you're able to make it and participate, the students would greatly appreciate your support. And it's that time of year for open enrollment. So open enrollment is your chance to secure the benefits that you want for the year. We are mandated by law the period of time we're allowed to keep this open. So if you can't or don't make the changes within that period of time, you're going to, by default, have the benefits that you had last year. And Mary Taylor's looking at me saying, don't forget to also say during this slide that related to health, and benefits are part of healthcare is part of your benefits, that there's no longer a reporting requirement at the university for COVID. We continue to get a great deal of questions. Jesse Zampedro has been fielding those. There may be requirements by the Ohio Department of Health around a positive test, but that does not affect us at the university. So you do not need to reach out to Jesse any longer, as the pandemic has been declared over, and you don't need to worry about that. On the other hand, if you get a positive test, you may want to check the Ohio Department of Health reporting requirements. Although, if you have your test done at a facility, they're going to help you with that and take care of that very likely on the reporting. It's also going to be a celebration of Women's Day. This is put together by our students from the College of Medicine who don't want to just recognize mothers during Mother's Day, but recognize the women in our lives who've had great impact on everything that we do. It's an incredible celebration that not only hit the mark on the number of attendees they wanted, but has expanded pretty significantly. This will be held Saturday, September 10th from 10 until 1 o'clock. I want to thank our students for putting this together. And again, the support looks like we're going to have a really great showing. If you're able to make it, we'd love for you to be able to support the women in your lives, the women in the lives of those of our students, our faculty, and our staff. But this is also an opportunity to come out and support our student groups who together. It's also a NEOMED celebration of health professions education. This will be October 16th. Between 12:15 and 4:30. If you're able to attend, there's both an online and a Zoom version. We are here for education, and certainly health professions education is what we do. So I hope we can get a really outstanding attendance for this. I bring this up now because our next update will take place after this. So look on your calendars. You'll see much more to come on this event. This is also the time of year every year that our students run their Tuwale celebration. And Tuwale is the Festival of Lights. We have a very large Indian American population on our campus, and this is a chance to come learn about Indian culture. And for those of you who love Indian food, there's always a wonderful selection of delicious food. So if you can support our students to come to this evening event, we'd love to have you be able to do that. And we have a few less folks joining us on the campus today as our Jewish members of our community are celebrating Yom Kippur today. And I did want to recognize the importance of this holy day for the Jewish community. And from those of you who are unaware, that's why some people may not be on the campus this afternoon. This will also be our second, I believe, our second ever TEDx event. This was started by one of our medical students in the past. She has gone on to do her neurology residency at Harvard, but she ran an incredible event right in this room, outstanding showing. And this is an opportunity to get NEOMED's name out with the well-known TED Speaker Series. So TEDx will take place here on October 21st. The topic is the art of medicine, the craft, connection, and culture to healing. So once again, a lot taking place this time of year. If you're able to attend and support this, I'd greatly appreciate it. And certainly our students will, as they're looking to make this an annual event at the university. There's also Fall Fest coming our way. And there are a number of events from cider and donuts to movie events that will take place with this. This is a really important element of this campus. It's about social and wellness activities to support our students above and beyond teaching, learning, research. It's a time for them to feel they're part of a big community and that we are here to support them and attend to all of their needs. And having faculty and staff attend to these events means a great deal to our students. So I know that the executive management team is making a concerted effort to get to these events, much like we did with the Backyard Bash, which was held for the first time by our Alumni Association and our advancement office, where 350 plus students signed up and came out and celebrated together. And I'm disappointed to share, although it's a wonderful celebration of his career, that Mr. Andre Burton has decided to retire due to, he shared the family issues that require much more of his attention now. After 33 years serving the state of Ohio, 11 which here on our campus, where he was both the chief diversity officer and for a period of time was the vice president for human resources, he's decided to part ways and tend to his family needs after really doing some wonderful things at this institution. All of you know he wrote our diversity strategic plan for HLC accreditation. He's reached out to our community and helped to make this a more welcoming place for people from all backgrounds and walks of life. And so our gratitude and our best wishes on retirement go out to Mr. Burton. He will be here with us until about October 31st, which time he's going to go on leave until his leave is used up and then formally retire sometime around November 30th. And before we move on to talk about Neovations, we're going to invite Dr. Kanal in to come tell you about both vaccination clinics as well as medication management and other components that he can offer to you through the NEOMED Healthcare Clinic and Neovations. I want to take a moment to see if there are any questions from the audience that I can address before turning it over to him, and then after him briefly to Dr. Frank Beck to give you an update on the College of Dentistry activity. Any questions here in the audience? Anything online? Here we go. With the growth of the university, is there a potential for NEOMED to expand our testing services location, similar to what I believe is done at the University of Toledo? This could help our students take their board exams and NEOMED exams in a more controlled, expanded environment. I will tell you that I can't answer this in detail for you. This will fall under our provost, Dr. Forrest Faison. And as far as some of the board exams, this will also be under Dr. Kat Trump, our Dean of the College of Pharmacy, and Dr. Mark Basson, the Dean of the College of Medicine. I think it's a great idea. They'll have to look into this. Mary, if you could remind me to bring this up. I'm sure they're working on something, but I will address this and see if there's something we can do in this. Great idea. Anything else? In that case, I'm going to turn it over to Dr. Amen. Kanal? You have one more slide, I believe, and then after that, shift them over to Dr. Beck.
All right. Good morning, everyone. Just as this photograph right here says, we actually have Dr. Fushetta and Dr. Beck, who are pharmacists. We had a pleasure of immunizing Dr. Langell and Dr. Faison last week. We just want to let everyone know that flu shots are a requirement for NEOMED. So those are available. We have made multiple clinics available for employees, staff members, faculty, as well as dependents. So make sure you go ahead and sign up for those flu vaccines. In addition to that, we are also providing RSV vaccines, shingles vaccines. We will be also providing COVID vaccines, the new booster, once they are available, and we'll do the clinics just like we did for the flu vaccines as well. So keep an eye out on that. One additional thing I want to mention about Neovations is during the last university update, Dr. Langell had mentioned that Summa Care premiums, again, giving faculty and employees the control over their premiums and the drug spend. So over the last 5 to 6 years, Neovations has helped patients as well as NEOMED, when we used to be self-funded, to save over $100,000 every single year. So if you guys are able to, you guys, actually we have a QR code right here. You guys can make appointments if you want. But both of our pharmacists would be willing to go ahead and talk to you guys or dependents about the medications that you're on, ways to save medications, and then obviously giving that power back to you, whether or not you want to make that change, whether or not you want to have that therapeutic alternative medication in a way that does the same exact thing, but at a better cost. So we are able to do those things for you. Feel free to go ahead and make those appointments. In addition to that, also want to mention that as the holidays are approaching, for NEOMED Healthcare, make sure, so we will be offering COVID testing as well before Thanksgiving, also before Christmas. So if you guys are going to be visiting family, please make sure you stop by, get tested. We did this last year as well and the year before. So we want to make sure that we provide those services to our employees here. We have open appointments. So if you are in need of having a physician visit, preventative visit, annual visit, please make sure you go ahead and sign up to have a visit with us as well. And for all employees as well as dependents on the Summa Care plan, I do want to say that there is no copay when you make a visit at NEOMED Healthcare and at our physicians. So I think that's all I have right here for Neovations and NEOMED Healthcare. Let's see if there are any questions. I can take those at that time. I do have a question right here. Do we need to submit confirmation of flu vaccination, or is that taken care of automatically if we have been vaccinated on campus? As long as you are getting the vaccines through Neovations Pharmacy Services, we will notify HR that you have already received the vaccine, so you do not need to submit proof of vaccination as long as you received your vaccine at the clinic here on campus. Thank you. Any other questions from the audience here? Okay, I will go ahead and hand this over to Dr. back here. Thank you.
Morning, all. I've been asked to give an update with regards to the progress on our Breton College of Dentistry, and I'll begin by welcoming our newest Associate Clinical Dean, Dr. Gene Fox from Nebraska and formerly from Case Western Reserve. So welcome aboard. Now we have 3 employees, so we're moving forward. The good news with regards to the accreditation status is that, thank you, Julie Altman, if Julie's here. She helped our Ohio Department of Higher Education application become approved in July. HLC, we've submitted part 1 and part 2 applications, and we will be having a site visit December 11th and 12th. and some training to begin in preparation on November 27th. I'm sure we'll be reaching out to several of you to help and assist us in preparation for this visit. And then lastly, our last hurdle will be CODA, the Council on Dental Accreditation. We did submit our initial application in February. We received a request to submit supplemental information in July, which we did September 1. We've been told that that will be a 30-day review, and we anticipate hearing at the end of October or beginning of November what their status is with regards to our having a site visit, which we would hope to have between January and April of 2024, allowing us to get on their summer board meeting for approval in July of 24, which would allow us to matriculate our class as anticipated by fall of 2025. The dental renovation continues. These are some of the architectural renderings as we begin to repurpose space and retrofit space so that we can welcome our students. There'll be two primary areas. Dental education is much different than medical education. If you're in the surgical realm in medicine, most of your training will occur in your residency years with regard to simulation services. Dentistry, we need to begin training dexterity and hand skills day one. So a dental simulation lab is necessary, and it actually looks exactly like a dental operatory. Each one of these has all the equipment with which you're all pretty familiar, and there's a mannequin head you can see with teeth. We have 55 stations, and of the 55 stations, our students will train there during regularly scheduled didactic and clinical classes, but obviously have to spend a lot more time practicing and honing their skills with regards to gaining clinical competencies and achievement. So we're moving forward with 55 of those. Obviously, that needs to be completed by 2025, and that is going to be located in the intermediate laboratory on the dental wing. The good news is that we have received good support with financial investments. Sherrod Brown's office provided us $2 million in a federal grant. We received $1 million from the state of Ohio in the last budget and have been awarded front-loaded $4 million this year. We thank John and Perry, first time we recognize Perry, for their efforts down there. We did have House Representative Al Catrona here viewing the campus on Friday, and we thanked him as well. And of course, the naming rights from the Dominic and Helen Batanti Family Foundation. We keep the Doctors Batanti uploaded with regards to our progress and what it is that we're making. And already, we haven't really solicited yet, but we do have $190,000 in scholarship monies that were donated without solicitation. So I think that, are there any questions with regards to the College of Dentistry, where we stand? Where will the student physical diagnosis lab be related to? That would be over my head. I'm not sure who would know that. Right, but I think the question was actually, where will the physical diagnosis lab, where will the activities in the intermediate laboratory be relocated to? Is that my understanding? Right. So working on as we start for a new location. No other questions? Well, thank everyone for their support, and we felt welcomed and embraced when we came on campus, and we're looking forward to a truly interprofessional education collaborative.